Kidney stones, also called renal calculi, are hard deposits made of minerals and salts that form inside of your kidneys. Diet, excess body weight, some medical conditions and medications all can play a part in forming kidney stones. They can affect any part of your urinary tract, from your kidneys, through your ureters, and into your bladder. Often stones form when the urine becomes concentrated, allowing minerals to crystallize and often stick together. Passing kidney stones can be quite painful, but the stones usually cause no permanent damage if they're recognized in a timely fashion. Depending on your situation, you may need nothing more than to take pain medication and drink lots of water to help pass the stone. However, if the stone becomes lodged in the urinary tract, surgery may be necessary. Your doctor may recommend preventative treatment to help reduce the risks of recurrent kidney stones. A kidney stone will not usually cause symptoms until it moves around in your kidney or passes into your ureters, the tubes which connect the kidney to the bladder. If it becomes lodged in the ureter, it may block the flow of urine and surgery may be necessary. At any point, you may develop these signs and symptoms. Sharp, severe pain in the side and back and below the ribs. Pain that radiates to the lower abdomen and groin. Pain that comes in waves and fluctuates in an intensity. Pain or burning sensation upon urination. Other signs and symptoms may include pink, red, or brown urine, foul, smelling, or cloudy urine, a persistent need to urinate, often called polyuria, nausea, vomiting, and fever with chills. Kidney stones have no definite cause, single cause, although several factors may increase your risks. Kidney stone form when the urine contains more crystal-forming substances such as calcium oxalate and uric acid than fluid that your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for the stones to form. Types of kidney stones depend on what they are made of. Calcium stones, usually in the form of calcium oxalate, which is made daily by your liver or can be absorbed from your diet. Certain fruits and vegetables, as well as nuts and chocolates, have high oxalate content. High doses of vitamin D, intestinal bypass surgery, and several metabolic disorders can increase the concentration of calcium oxalate in urine. Calcium stones may also occur in the form of calcium phosphate. This type of stone is more common in metabolic conditions, such as renal tubular acidosis, and also may be associated with certain medications used to treat migraines and seizures. Struvite stones form in response to a urinary tract infection. These stones can grow quickly and they can become quite large, sometimes with few symptoms or little warning. Uric acid stones can form in people who lose too much fluid because of chronic diarrhea or malabsorption, or those who eat a high-protein diet, those with diabetes, or metabolic syndromes. Certain genetic factors may also increase your risk of uric acid stones. Cystine stones. These stones form in people with a hereditary disorder called cystinuria that causes the kidneys to excrete too much of a specific amino acid. Now, there are several risk factors that can increase your risk of developing kidney stones. A family or personal history. If someone in your family has kidney stones, that automatically increases your risk. Dehydration, not drinking enough water every day, puts you at higher risk of kidney stones. Certain diets, eating a diet that's high in protein, sodium, or sugar, can increase your risk of some type of kidney stones. Everybody's talking about the keto diet. That can put you at risk for, increased risk of kidney stones. Obesity, having a high BMI, a large waist size, and weight gain has been linked to an increase in kidney stones. Digestive diseases and surgeries, gastric bypass surgery, IBD, chronic diarrhea, all of these play a role in your risk factor for developing kidney stones. They affect your absorption of calcium and water, which increases the amounts of stone-forming substances in your urine. Other medications, such as renal tubular acidosis, cystinuria, hyperparathyroidism, and repeated urinary tract infections, also increase your risks of kidney stones. Certain supplements and medications, such as vitamin C, dietary supplements, laxatives, calcium-based antacids, and certain medications used to treat depression or migraines can increase your risk. Now, there are several ways to diagnose kidney stones, such as blood testing. Blood tests may reveal too much calcium or uric acid in your blood. Blood tests can help monitor the health of your kidneys and may lead your doctor to check for other medical conditions. Urine testing. A 24-hour urine collection may show that you're excreting too many stone-forming minerals or too few stone-preventing substances. For this test, your doctor may ask you to perform 2 urine collections over 2 consecutive days. Imaging. Imaging tests can show stones in your urinary tract. High-speed or dual energy, CT, can reveal even tiny stones. Simple abdominal x-rays may be used less frequently because this kind of imaging may miss kidney stones. An ultrasound, which is a non-invasive test that is quick and easy to perform, is another imaging option to find kidney stones. Now, analysis of the past stones. You may be asked to urinate through a strainer, as seen here, to catch stones that you pass. Now, I'm going to show you exactly what will happen. Your doctor will give you a strainer, and then you will have a hat that sits on your toilet. When you urinate through the strainer, it will catch any kidney stones that you may have. And as you can see here, there's sediments, which are what some of your kidney stones may look like. Now, the lab analysis will reveal what your kidney stones are made out of. This will help your doctor determine the proper treatment and the type of diet and medications that you can use to prevent future stones from forming. So treatment, it varies depending on what the type of stone is and what's causing the stones. For small stones, these usually don't require invasive treatment. Usually just pain medication and drinking more water is all that you're going to need to help you pass these stones. Your doctor may give you a medication to help pass your kidney stone. This type of medication, which is known as an alpha blocker, relaxes the muscles in your ureter and helps you pass the stone more quickly with less pain. Examples of alpha blockers include Flomax or Jalin. Now, for larger stones that cause symptoms, your doctor may perform sound waves. ESWL uses sound waves to create strong vibrations and shock waves that break the stone up into tiny pieces so they're more easily passed. Very large stones that aren't receptive to the sound waves, we may have to do surgery. This is called a percutaneous nephrolithotomy, and it involves surgically removing a kidney stone using small telescopes and instruments through a small incision in your back. Now, sometimes kidney stones can cause complications, which further require treatment such as UTIs. It can lead to sepsis, which can be a life-threatening condition if left untreated. A kidney stone may also become lodged and block a ureter, thus requiring surgery. Large or abrasive stones can injure the ureters, causing further pain and complications. Now, at any time, if you have difficulty passing urine, blood in your urine, pain with nausea, vomiting, sweating, if the pain becomes too severe that you cannot find a comfortable spot, that is when you need to see your physician. Now, I have also made up a kidney stone here, which is obviously enlarged, just, so you can see what the sharp edges, and can you imagine passing that through a ureter and into your bladder? Whew. So that's my demonstration on kidney stones. I hope that you found this entertaining as well as informative, and here are a list of my references. Thank you.